Good evening, everyone. Are my slides visible?
Yes, your slides are visible.
Okay. So good evening, everyone. I would like to thank ISMPO for this opportunity. So today I'm going to present my poster, which is on caregiver burden in caregivers of older Indian patients with cancer. This is an experience from our tertiary care center. So as we know, caregivers play a vital role in the care of patients, especially in those with chronic debilitating illnesses. And most of the long-term care which is provided in our country, especially in many other countries, include for older adults, is by unpaid family members or informal caregivers. And what is caregiver burden? That is the main question. And in literature, multiple diseases have been defined, codes have been given to various diseases, but one of this caregiver burden has not been defined formally by anybody, nor does it have an ICD code. Zaret, who has worked on caregiver burden and developed in the questionnaire, has defined it as to the extent to which caregivers perceive the negative effect of caregiving on the emotional, social, financial, and other parts of life. And we know many times caregivers are unprepared and find it difficult to cope with the situations that they have to deal with. Another important fact is that in the Indian context, very little information exists on caregiver burden, mostly in patients with dementia or psychiatric illnesses or other chronic illnesses. Almost no information in the oncology setting. So we conducted this study to estimate the prevalence and severity of caregiver burden in our patients. So this is the study was an observational study. Caregivers from our of around 127 consecutive patients from the geriatric clinic were included, and patients were aged more than 60 years. We used the Zaret's caregiver burden interview, and descriptive statistics and a multivariate analysis was used for analysis. This is the Zaret burden interview, which consists of 22 questions with the Likert type of scoring ranging from 0 to 4. That is, 0 is never and 4 is nearly always. And the caregivers were asked to fill questionnaires, and these were also administered in that validated translation in Hindi and Marathi as well. And this ultimately has a composite scoring, and the scores are added up to give 4 categories. That is 0 to 20 with little or no burden, 21 to 40, which is mild to moderate burden, 41 to 60, which is moderate to severe, and 61 to 88, which is severe burden. Now, coming to the results, these are the baseline characteristics. Majority of the patients in our clinic who attended the geriatric clinic were male, around 75%. 55% were receiving treatment with a palliative intent, a median age of 69. Just a few points to highlight. We had predominantly lung carcinomas and GI cancers. Most of the caregivers, 74% of the caregivers of these patients were children who came, and 68.5% of the caregivers were men. So these are the scores that you can see on the screen. 76% of caregivers reported little or no burden. That means scores less than 20. Around 20% said they had mild to moderate. Moderate to severe was seen only in 3%, and only one patient, which is around 0.8%, reported a severe burden score, the caregiver. This is the median caregiver burden that score that was 12, and it ranged, the interquartile range was from 6 to 20. These figures show the distribution as per age. So this is around 60 to 70 years, 71 to 80, and over 80 years, and as per the gender of the patient. Now, this is an important multivariate and univariate analysis we did. We analyzed the patient's gender, the educational status of the patient, the relationship of the caregiver and the patient, the primary tumor site, comorbidities, the functional abnormality in the geriatric function domains, cognitive impairment, malnutrition, and psychological issues in the patient. That is a presence of depression or anxiety, which we had assessed on the GDS and the GAD-7 scale. And based on this, what we noted is 2 important facts: that caregivers of female patients and caregivers of patients with psychiatric illnesses, they had significant caregiver burden. You can look at the p-value here, it is significant, and here, both of the univariate and the multivariate analysis. And some other factors like patients with geriatric function domains and patients with malnutrition also the caregivers reported higher burden, but it was not significant in the multivariate analysis. So to conclude, the overall incidence of caregiver burden in our setting in these 127 patients, caregivers whom we analyzed, was low. 76% or more had reported little or no burden. And patients, female patients or patients with psychological issues, their caregivers reported higher levels of caregiver burden. So with this, I would like to conclude and thank you, and I'd be happy to take the questions.